Welcome to the Six Hats podcast, where I, Dr. Shami, a lifestyle and nutritional medicine family doctor, will talk about how women strive to find balance each day by juggling their six roles, being a woman, mother, daughter, partner, business owner, and professional. Hello, everyone. Welcome back to the Six Hats podcast. And today we have Steffan Cavalera. He's a physiotherapist from Kieser in Fitzroy who sees an array of injuries but has a special interest in low back pain. And this is what we're going to get into in today's podcast. Now, what I love about Steffan, that he's actually been through an 8-year journey of chronic pain himself. And so he gets it. And he's passionate about getting people who have injuries to get active and find long-term solutions. So welcome, Steffan.
Hello, Shami. Thanks for having me on.
So Steffan, I always love to start with a story, as my listeners know, and I'm curious about your 8-year journey of chronic pain. I'd love for you to share. How did it all begin?
Well, I was pretty young and naive when I first started lifting weights. It was in the school environment, and I actually lifted up a barbell from the ground and just acutely hurt my back. I'd never hurt my back before, so I was pretty unaware of what I might have done to myself, and went and played footy later that day. And then I had debilitating pain for the next week. I eventually got attention, but I didn't really get any clear answers until I had a really acute episode of pain during the night where actually I had to call an ambulance, got rushed to hospital. The end result was I found out that I had a herniated disc, and that was the reason I was in such pain, and the pain was going down the legs. It had a big impact on me. I had to stop playing the sport I loved. I found it pretty difficult sitting at school and staying in class. And it was pretty much just a long journey from there. I saw different healthcare practitioners, and the main message is you've injured your disc in your back. That's why you have pain. There wasn't much around what I could do to make it feel better, apart from you can have some pain medication and it should get better. You should avoid lifting weights and don't return to sport until you feel better. So I guess I came pretty fearful after that. Every time I had a bit of a strain in the back, it kind of spiraled to another week or two of being pretty much disabled. Yeah.
Wow. And so how old were you when you had the back pain?
16.
Oh, wow. And it's almost because literally I just went to the gym this morning, and I do have a personal trainer. And that was my main reason for it, is to do it properly. And you've just highlighted how easy it is, because, there's a lot of young people at the gym lifting very heavy weights. It's easy to hurt your back.
Yeah, I wasn't trying to break any records. I was just, I just didn't understand my limitations, and I didn't understand the technique of lifting weights.
Wow.
Yeah.
And so on that journey, I'm really excited that you said it was very limited, the kind of information and advice you get, because when I reflect back on years being in GP practice, it is limited what we give. And it's almost literally what you said, pain meds, see a physio for exercises. However, that's literally it. It's not much more information we give. And when you think about it, it has a massive impact on their lives. So not only you couldn't play your favorite sport, you could not only sit in class, and that would have affected school, but also socializing. So what was your journey like? Like, how did you find solutions?
I think at the time I thought I was stoic, and I pretty much put up with it for a really long period of time. When the footy season ended, I had enough time to relax and swim. And what I understand now is that I probably would have healed up for the most part. It wouldn't have completely healed, but I should have been in a good enough position to start doing some rehab and re-strengthening the muscles that would have weakened over that period of time. But because I didn't have that understanding, every time I kind of pushed myself a little bit, I'd get sore again, get back to resting, not doing much. I ended up seeing everyone from physios to chiros to osteos. Hands-on therapy always gave me a couple of days relief, or it might even give me a sense of confidence for a week, but nothing ever quite got me to the stage where I felt really comfortable, where I could play sport without thinking about my back, or even sit down at a restaurant without thinking about my back. So it actually sparked me to become a physiotherapist. And with the help of a few other really good physios and what I learned about my body along the way, I'd realized that I'd become really protective of my back. It changed the way I moved. It changed even what I did socially. So when I'd get that sensation that I was potentially in danger, I felt a lot of pain, which then further restricted my movement and caused this ever spiraling effect of me avoiding things, me getting sore, me being fearful. And it wasn't until way down the track that I got the right mix of advice, exercise, lifestyle management that I was able to get on top of it. But I did feel that it was just a problem that I'd have to live with for the rest of my life.
Wow. And what I'm hearing as well is like when you is affecting your life socially in various aspects, did it affect you mentally? I heard fear, but did it also get you down at any point?
Yeah, I think it got me angry more than anything because I felt so physically capable before it that I'd get frustrated at myself if I tried to go back to the gym and do deadlifts or do squats, and I'd get that warning of pain again. I'd think to myself, I'm far too young for this.
Yeah.
Why can't I be able to do this? Why me? Why can't I get better? I try so hard. So, yeah, I think a lot of frustration and anger came out of it.
Wow. And thank you for sharing. I think it's important that we do talk about it because many people are suffering in silence and would resonate with your story for sure, Stefan. But I'd love to move on to let's talk more about what we can do for chronic back pain. And you're going to mention a couple of areas such as the different types of pain. So I'd love for you to start.
Yeah, thank you. If we were to classify pain, there's three main classifications. So we have our nociceptive pain, and this is really our traditional Western view of pain. It dates back to even ancient Greece and ancient Rome, that what happens to the tissue is accurately reflected in our experience of pain. So that probably is what most people would think of when they experience pain. The other pain that there is neuropathic pain. So neuropathic pain is around if you have some damage to a neural structure. So people who have diabetes might experience pain in their periphery because of damage to the nerves in their periphery. Or someone might experience pain down their leg because they've got a disc in their lumbar, their low back, that's protruding on one of the nerve roots. So that's what I was experiencing at the time when I was younger, or one of the things that I was experiencing. Both those pain experiences can actually be altered. And that's where we go into nociplastic pain. Nociplastic pain is the amplification of the experience of pain. And it can actually also result in pain occurring without any threat to the tissues.
Wow. Funnily enough, I've not heard of nociceptive pain. So that's really interesting. Yes, we see neuropathic pain all the time and the nociceptive pain, and often it's pain meds or meds for neuropathic pain. So could you explain more about nociplastic?
Yeah, I think if we go into the different theories about why we experience pain, that probably leads nicely into nociplastic pain. So I spoke about nociceptive pain being X happens to the tissue, the response is Y, what we feel. But that's very traditional. It doesn't take into context all the other things that happen around an experience of pain. So that biomedical classification of pain is pretty much the cornerstone of Western medicine when someone presents with pathology with pain. A new theory that we tend to use a little bit more, or hopefully most of us do, is the biopsychosocial model of pain, which talks about, yes, there is this biomedical thing that happens. Something happens to the tissue. We get cut, we get hit, we experience extreme heat, but that also interacts with our psychology. How are we feeling at the time? What's happened in the past to us? What are our fears? What are our anxieties? And then social, what's going on in our lives at the time? Do we have a lot of pressure? Does this happen in a workspace? And is there support in that workspace? Do I have private health? So an example I would give with the biopsychosocial model is if you think of two identical people physically. They're at the same age, they've got the same physical capabilities. Both of them bend down to pick something up, and that object is a little bit heavier than what they expected, and they feel an acute strain in their back. I think most people have felt that sometime in their lives, or at least us older people. We feel a bit of a strain and a shock. So if you have person A, let's say they're a single parent, They work 40 plus hours a week and they're responsible for their 2 children. They don't have private health insurance. Their work requires them to be quite physical and they can't afford to take time off. They have stress around their bills and they don't have much social support. You could imagine the pain or the experience that they have could be different to person B who, say, works a fairly comfortable job, easy hours, has a good social network, is really comfortably financially, doesn't have a lot of stresses going on at the moment. So it can be the same physical external input, but the internal experience could be much different.
Wow. I think many listeners would really resonate with that because what's actually happening in your life and how you interpret it, the pain can be so different. And I actually see that from a clinical point of view, why someone with severe chronic pain has carried on, pushed through, while someone else is actually bedridden. So it's really interesting. The experience of pain can be very different.
Yeah, and there's a nice way to put it. There's a new theory called complex emergent systems, and it refers to us as an ecosystem that's affected by both internal stimuli, what's going on within our body, what's going on within our mind, and external stimuli, what's happening around us, what's happening in the context of that time. It's ever evolving. So our experience of pain isn't just affected by what's happened right then. It might also be affected by the experiences we've had in the past.
A great point. I was just about to move on to that, actually. Can we talk about how past beliefs affect how you manage pain in the present moment?
Yeah, I think we won't get too scientific, but if we go back to nociceptive pain, so nociceptors, another way to refer to them can be mechanoreceptors, but what they do is they detect some sort of change in the tissues in the periphery. So if you've got nociceptors in your skin might detect that something becomes really hot all of a sudden, or nociceptors within the back muscles that detect that they've been stretched all of a sudden or they've been compressed, they're under a certain amount of load. That information is sent to the spinal cord. And there's this little interface where the nociceptor has to send information across a small space to the dorsal horn in the spinal cord. Now, how much information goes across can actually be impacted by previous experiences. So I won't get too far off track, but if you think of when you put your t-shirt on, you feel your t-shirt immediately, but you don't walk around throughout the whole day thinking, oh, I can feel my t-shirt on my chest and my
True.
back. Because that information, both at a peripheral point in that interface between the spinal column and the nociceptor and in the brain, is deemed as not important. Now, if we go back to maybe back pain, I've lifted something up all of a sudden, and this information is going from the nociceptor to the central nervous system, so to the spinal cord. Well, we've got certain pathways that can amplify that signal. So we can amplify the messaging, we can amplify the signal going up the spinal column, and then that gets interpreted in the brain, and that's where the context comes in. So if it's someone, I'll use myself, if I lifted something and I felt a bit of a strain, okay, what would go on in my mind? Well, first it would go to, okay, I feel it in this area of my body. Then it would go to, have I experienced this before? Yes, I have experienced this before. What happened to me last time? I hurt myself. What effect did that have on my life? Oh, I had to stop playing football. I struggled to sit down at school. Or eventually in adult life, I struggled to sit down on the chair. And all these things happen really rapidly, and it's very much in the subconscious. And then the output might be is that, oh, I feel pain, I'm in danger, because that's all pain is. It's a signal of whether we're in danger or not. So that feeling of pain can be a real amplification of what's happening at a tissue level. Secondary to that, I can have maladaptive responses. So if I think that I'm in danger, I've hurt myself, well, my muscles then might brace and guard myself. And that quick brace of muscles will give more feedback, and I will all of a sudden feel very fatigued and tight. And that feedback loop will continue. I'm in pain. I need to protect myself. I need to tighten up. So that's pretty much a short example of how we can get a stimulus that's not really threatening, but then we can experience a high amount of pain.
Absolutely. I loved how you actually mentioned fear and anxiety around it can really escalate your pain. And I actually see that in many patients when I reflect, when you were speaking, I go, wow, I actually see that because I can have someone like I literally mentioned who's in so much pain, but is just getting on with life. And
Yeah,
while,
there's a little bit of research there. There's a couple of books. I don't know if I'm allowed to share the titles.
yeah, absolutely, really important. Yeah.
One is called Why Does It Still Hurt?
Oh,
Okay.
yes. Yeah.
I think he's a Melbourne-based ex-doctor who is also an author. And the other is The Body Keeps Score, which
Yeah.
is a famous one. So, I mean, they reference to quite a few different things, studies that have a look at what happens in the brain when someone experiences pain or when they even think about a traumatic
Mm.
experience. So your kind of traditional view that X happens in the tissue, we experience Y. Whatever we experience is directly correlated to the intensity of what's happening at the tissue. So if that was to happen, then there's an area of the brain, the sensory cortex, that fires up. So they can show that on imaging. For people who have had trauma-based pain, they've been in a car accident, they've hurt themselves really badly, and they've developed persistent pain, anxiety around that pain. When they experience a sensation, so if you were to touch them in that area, or if you were to talk about an experience they went through in the past that was painful, other areas of the brain fire up. So the amygdala, the hippocampus, so parts of your limbic system that are involved with your emotion fire up strongly as well. So the idea that when we experience something, it isn't just the sensation in our tissue. It is context to that. It is memory. It is emotion as well.
And when you do tell such stories to your patients, do you notice a shift in whether they require as much pain relief, how they interpret pain? Do they feel much more, do they have a different experience once they know exactly what you've been saying?
When someone has really persistent pain, if it's someone who's had pain for a couple of years and it's taking a large toll in their life, just telling them that often upsets them.
Mm,
So it can be almost, they can take it as an attack on them. Are you saying that I'm crazy, that nothing's going on, that I'm exaggerating my symptoms, which is very much the experience I had when I was younger. When someone brought this up to me, I was like, oh, but I'm a strong guy. I'm resilient. I can,
it's almost
there must,
dismissive, isn't it? It's almost just,
yeah,
yeah,
yeah, exactly right. So I think we have to be really careful about how we communicate this information. It can be really powerful. I think one thing to remember is if we think of experiencing pain on a spectrum, on one end of the spectrum, you've got something that's completely biomedical, biological. Someone's fractured their leg. They've fallen off a bike and they've completely fractured their leg, and the pain that they're experiencing is potentially largely around that. On the other end of the spectrum is more your psychosocial, okay? What's going on in their life at the moment? What other comorbidities do they have? Do they have anxiety, depression? What pressures do they have in their life at that time? And the pain that that person might experience, potentially, not always, is more on that end. So everyone experiences something on that spectrum. So I think when talking to clients, I always try to express that, yes, look, there is this scan that is showing this, or you've had this injury. We can see that clinically from the tests that we do, but it's not the only reason you're feeling pain, or it's not the only reason you're limited in what you're capable of doing.
amazing, amazing. And can you take us on a journey with a patient that comes to see you so we can literally talk about some solutions?
Yeah, well, I'll give you a couple of quick successful stories that I will preface this with. Usually, persistent and chronic pain takes really a long-term strategy, collaboration between a number of healthcare practitioners. It might be a GP, a physio specialist, a psychologist. But in these couple of cases, I was just quite lucky. I had people that were receptive, that were able to make a quick recovery. So one gentleman that came in to see me had come in to see me 10 years after having a disc herniation, a low back disc injury. And that happened like a lot of people lifting something up, and he lifted something up and rotated quickly and felt a sharp pain. And that pain worsened the next day as what we know about the biological process, inflammation occurred and a number of other things happened to basically warn this person that they're in danger and they need to protect. Now, he went through a couple of months of pain and seeing doctors and eventually saw a specialist who pointed out an MRI. This is your issue. This is what you've done. You are at risk. You should not bend through your back again. Otherwise, you're going to hurt yourself again and you might need surgery. So you could imagine being a patient in that situation. It's frightening. We put a lot of trust in our healthcare practitioners. The reality was this person was a couple of months down the track. There was a lot of healing that would have taken place at the muscles, even at the disc, even if it doesn't heal fully. And the reality is pretty much any male in his age bracket would have some sort of pathology in their back. It might not be a herniation. It might be a slight protrusion of the disc. It might be a thickening of the facet joint, which is a part of the spine that can be a source of irritation. There's several things that can happen that cause pain, but most people walk around with these without any symptoms. Okay, so if he'd have got told that, look, this has happened, but this can be a fairly common thing and you'll recover and you're better, he might have had a different decade after that. But his decade after that was he really felt he had to protect his back. So he adapted strategies to avoid bending through his back. If he had to get something off the ground, he lunged. If he had to put socks on, he stiffened up his back, kept it dead straight, and lifted his leg up. Wow. After 10 years, I think he just got sick of doing that and wanted to see if there's anything he could do to improve it. So I spent some time with him just reaffirming what I said before, that actually, you can have these issues. The body's amazing at healing. Even if it doesn't heal fully, you can get through everyday life with a bit of a protrusion or a little bit of a disc issue. I spoke about the spine being a really stable structure. It takes a lot to get a disc to move. It's not going to happen putting your socks on or lifting a shopping bag. And then I gave him a couple of resources. So a couple of YouTube clips, one from Lorimer Mosley. I don't know if you're familiar with him.
Not familiar, yeah.
So he's a physio based in South Australia, part of the NOI group. They're really the gurus in this area in understanding persistent pain, chronic pain, and how to deal with nociplastic pain. He's got a really nice YouTube clip, Why Things Hurt. It's from a TED Talk, and I shared something from another famous physio who specializes in low backs, Patrick O'Sullivan.
Right.
Actually, might have got his first name wrong, so I'm sorry if I did. But he speaks about kind of the misconceptions around back pain. Basically saying everything that this client's specialist didn't say, that you can heal, that you should encourage movement slowly, do your best to get back to normal activity and try and strengthen your back eventually and get used to loading it. So I shared those resources with him. And after I chat, I just set him one task, that when he goes home, every time you have to either pick something off the ground, put a shoe on, put undies on, I want you to take a deep breath. And I just want you to remind yourself that you're safe. Amazing. You're okay. You're not going to injure yourself. And just see what happens over the next week if you do that every single time. So we caught up a week later, and within 7 days, he went from only being able to reach just above his knees to reaching a few centimeters above his ankles.
That's amazing, Steffan. That's amazing.
Yeah, it was a pretty dramatic change, and it was only because he was open to the information. I hadn't stretched his muscles. I hadn't done a magic piece of hands-on therapy. I just shared what we know now is knowledge around pain and low backs, and he was willing to take it on board.
What I'm also hearing, Steffan, is that he trusted you, and that's so important, the trust in the practitioner to be able to follow through with the practices that you gave. So good on you for creating that trust.
I think I was lucky in that situation that we got along immediately. I think we shared a similar cultural background, and we were able to just have a social chat about family. Otherwise, you're right, building trust with a client can be so difficult. When you are a client or a patient, you might be getting 5 different opinions from 5 different healthcare practitioners.
Absolutely. That's an amazing story. Do you have one more to share before Will you wrap things up, Stefan?
If it's okay, I'll share two. Another one would be someone who I was familiar with. They were a client of mine for a couple of years, and they presented with really acute neck pain one day. So they said they couldn't move their head, they weren't sleeping, they were really struggling to work, and they were getting pain radiating over their right shoulder. Now, because I already had a bit of context around this client and his social life, I just asked him a bit further about what was happening in his life at the time without crossing any boundaries, because I'm not a psychologist. I want to make sure that I'm not giving out psychological information. I'm maybe just passing on education or shared knowledge. It turns out that he had a performance review at work that didn't go so well. He had a relative who was unwell and overseas, and he was having some relationship troubles. So when he wasn't working, he was burying himself into his phone, either checking on his relative overseas or distracting himself on social media. So understanding that he very unlikely has a really serious tissue pathology, because I did a couple of clinical tests just to be sure that nothing outrageous happened in the last couple of weeks. We worked on just a couple of strategies to help him feel better and calm down. So I knew the client loved cycling. He hadn't been cycling the week before. So we said, okay, can you make time twice this week to go to a nice track that you enjoy riding on and make that a priority? Can you make sure that before and after work you go outside? So you're not going from your laptop straight to your phone or to the TV. Just go for a walk outside. It doesn't have to be really vigorous. It doesn't have to be a run, but just something to get you moving and get you seeing sunlight. And I also asked him to just go chat to his chemist. I said, is there anything you can ask for that is natural, that can help you sleep better, that might calm you down a little bit if you are feeling nervous? So I saw him on the Monday, and as I expected, he came back on Friday with no neck pain.
Wow, that's incredible.
So these both are extreme success cases. I think you'd know from your practice, most of the time it's really difficult. But what it does do is it highlights that, these are two people, that one that had a really significant disability, he couldn't reach to his knee, and the other one that had a really high pain that he couldn't move his head. And we didn't change much physically. We didn't really change anything. We just added education, changed their beliefs, and we collaborated to find a few practical things that made their week a bit happier.
That's amazing. That is
Yeah.
amazing. Wow. It makes me actually reflect on so many patient stories that I've heard, how it's important to actually look at the environment and look at other reasons for that, that specific posture and the stress response and how
Mm.
that impacts. Because from a clinical point of view, it's very quick to go, right, let's look at x-rays and MRIs and almost go on a tangent without even looking at the basics in front of you. So that's really good story, Stefan.
Thank you. Yeah. And I think, as you would know, when you start to scratch below the surface, there often is all these other stresses happening in that person's life. And if you've got time, I'd share one more that probably reflects more of what we'd see in clinical practice, meaning it's not an amazing change within a week. It's a long-term change that takes a lot of effort from the client or the patient. So I think of someone who presented to me 2 years after low back surgery. So
Right.
to preface it, they had 2 to 3 years of low back pain before they had surgery. It was kind of like a low level strain for a year. And then they had a couple of really uncomfortable years, and they got a microdiscectomy, which is cutting part of the disc out that was protruding on one of the nerves in the low back. And they got a little bit of their bone cut out as well, which is a really common procedure. And for some people, it's amazing. That person, though, finished surgery, got out of hospital, went home, and found that they were still in the same pain that they were pre-surgery, despite the scan revealing that the problem that was there on a physiological level had now been removed. So that person had a really stressful couple of years trying to figure out, why am I still in pain? And his advice from the surgeon is, you should be better. It'll just take time. He's services where he got a couple of physiotherapy sessions from the hospital. I think it was 3, which is your kind of standard care to first tell you these are your limitations and then progress you back to what should be normal movement and activity. But this person just never got it back. So by the time he saw me, he was struggling to sit for 10 minutes at a time, which really impacted his ability to work. He was finding it really difficult to do household things, put a dish away, vacuum, and then his personal things like putting socks on, putting undies on. Socially, it had such a large impact on his life that he was nervous to catch up with friends because he thought, God, if I sit on a bar stool, the next day I'm going to be bedridden. So
Wow.
there was that fear of pain that was happening before he even had the chance to experience a sensation. So he limited his behaviors for a couple of years, and it got to the stage where it really affected his mental health. So when I caught up with him, we had to really look at everything. We had to look at his strength. How well could he use the muscles in his tummy? Could he do an abdominal crunch? Could he do a glute bridge? What was the strength in his back muscles like? And you could imagine if you've got limited mobility and you restrict your activity, you're going to be really deconditioned. His big fear was, look, if I can't put socks on, I'm not going to be able to lift a barbell at the gym. And he was right. I think if he went to the gym and tried to do a deadlift, whether it had a really big impact on the tissues or not, he still would have experienced a high amount of pain. So for his journey, it took about 6 months of education, lifestyle adjustments, so changing what he did throughout the day to make sure that he wasn't always sitting at work, changing his setup at work, and then adjustments to how he lived his life. So making an effort to catch up with friends so he didn't feel so alone and hopeless. When it came to gradual loading, I'm lucky at my workplace, we've got specialized equipment where we can gradually load someone's lumbar spine. But if I didn't have that equipment at hand, then I just have to be really deliberate in how I loaded that person's back and catch up with them regularly. So there's huge financial burden to this person. And that's a reality for a lot of people, is it is going to take a lot of help from a physio, from a GP, from a team of people before you get to the stage that you're on the other side. So it took 6 months until he could sit down at dinner without experiencing really high pain the following days. It took about a year to get him comfortable being at work. And even a couple of years down the track, he's still battling through and strengthening and challenging his past beliefs that he's in danger, because he had a real embedded feeling that his back is in danger. His back would be stuffed for the rest of his life. And that's the reality for a lot of people that experience persistent and chronic pain, that it's going to take a big effort from them. There is definitely light at the end of the tunnel, but they have to be willing to challenge their beliefs and eventually try and find the right help and put faith in the right people. So there's a lot of bits on that journey, a lot of moving pieces, which makes it, very difficult.
And I'm so glad you shared that, because often in today's world, we want a quick fix, and it takes that consistency, turning up, that regular consults with yourself, but also just patience. And in order to get the results that you want, and I often see patients, I want a quick fix. This has to go in a couple of weeks, in a couple of days. And I'm really glad that you shared the story that it can take 6 months to a year, but you can get there. And it's a journey. It's very much personalized as well, what that journey looks like. Thank you so much, Steffan. This has been so incredibly informative. And I'm going to actually share those resources that you mentioned, those 2 books, but also the YouTube clips. I think that's going to be really helpful for so many patients and so many of our listeners. So thank you so much, Steffan. So before I let you go, where can people find you?
I'm based at Kieser in Fitzroy. It's on 498 Brunswick Street, and I'm always willing to see anyone. If you've got something that has been bothering you for a very long time, that's particularly in my
Oh,
interests.
brilliant.
And yeah, I think your point of you need patience, that's correct. And that's coming from someone who is very impatient with anything for myself. You need patience, but I think you need a network of people that can help create positive change. Because again, if your outlook is I don't think this can get better and I'm in danger, I think that will really affect your ability to recover. And there certainly is light at the end of the tunnel.
Amazing. Really wise words to finish off. Thank you so much, Steffan.
Thank you, Shami.
Remember that this is general advice only. Please see your healthcare professional for more information. So what's your take-home message today? Remember, it's all about progress and not perfection. And are you suffering from stress? Visit the Usawa Learning Hub on usawa.com.au for more resources on how to de-stress, re-energize, and reclaim your health. Enjoy the journey.